Okay. Cool. Well, thanks everyone so much for joining. I'm going to go ahead and kick it off. So welcome to Austin Design Week 2020. We are so glad you're here. My name is Maddie Huey, and I'm on the ADW team this year. You can see here that you can connect with us and share your experiences over the week by tagging us on social media. So there's some hashtags on this page. Cool. Go to the next page, Mark. Awesome. So if you haven't already, we encourage you to join the ADW Slack workspace. Please check the Zoom chat where we'll be putting that link and several other resources for you. And we encourage you to continue the conversation there. There are free events all week, so we encourage you to check the schedule and join us for more. And then we also want to say a huge thanks to our generous sponsors for making this year happen. And then finally, at the end of the event, we'll be putting in a brief survey and we'd love to hear from you. Okay, so now I'm going to pass it over to our amazing host, Mark, and we'll get this event started.
Hey everyone, I'm Mark Jankar. I'm a user researcher with the City of Austin Service Design Lab, and that is within the Office of Design and Delivery. I have a background in sociology and paramedicine, and how I came to service design is as I was a medic in Portland, Oregon before I moved to Austin, I realized that we were treating a lot of the same patients who were experiencing homelessness night after night. And it seemed like we were putting a Band-Aid on a larger systemic problem and not really solving it. So I wanted to think about problem solving, and I started studying service design and user research, which I found to be a pathway to the collaborative problem solving of service design. So I've been with the City of Austin Service Design Lab for about a year and a half. And in that time, I've been fortunate to work on a lot of programs and pilots addressing homelessness, like the Violet Bag Encampment garbage collection program and the new Keep Safe storage facility for people experiencing homelessness. So I was working on these pilots in April when the City of Austin put a call out to city employees to assist with the COVID-19 response effort. I joined the alternate care site team. And what I'm going to talk about today is how we build a field hospital from scratch for COVID-19 patients and how city employees rose to this occasion by learning new roles and responsibilities. And I'm gonna focus on 3 problems that we encountered that we use design thinking to solve in the course of that. So just a background of how this came to be. The City of Austin Travis County Emergency Operations Center is a command structure that gets activated when disasters happen. Happened in Katrina, Hurricane Harvey. It also was activated during the serial bombings of South by Southwest in 2018. So when COVID hit in March, the EOC was activated and there were several branches to the city's response, which the EOC instituted. These include testing, epidemiology, the isolation facility, which is a hotel that the city leases, which gives a place for people to quarantine who are exposed to COVID and tested positive and have no other place to safely quarantine. UT students, civil servants, paramedics, people who don't have anywhere else to go, that's for them. The protective lodges, these are 5 hotels that are currently housing over 300 people who were formerly experiencing homelessness that didn't have anywhere to go to shelter in place. It's pretty incredible. There's 5 of those hotels running now. The alternate care site, which is the team that I joined. And there's a vaccination task force, which is setting up the bones for how a vaccine is going to be distributed when we eventually do get it. So the call went out for the alternate care site as just one branch of this response. This is what the org chart of the response looks like on paper. It's very hierarchical. There's a command structure, there's chiefs, deputy chiefs, but in the public health group, we all report to the medical director who at the time was Dr. Jason Pickett. Within each of these task force, there's a separate command structure itself. So in the alternate care site team, there's a commander, there's a logistics section chief, a planning section chief, finance, operations, medical, and they really needed help with all of these positions. So I looked at them and I chose planning because what is a design if not a plan, right? So what a plan chief is responsible for is laying out what the policies and procedures of the alternate care site are going to be, the design for what the tent layout is going to be, how it's going to meet all of those needs. And that's kind of been my day-to-day ever since April. And we continue to do this work. So what is an alternate care site? They're all over the country. What they are is a pressure release valve for a hospital system. When a patient load exceeds the surge capacity of a hospital system, and there's nowhere else for people to go, we need a place to put those patients. It's similar to a hurricane shelter, but alternate care site is unique in that it has to have all of the functioning capacity of a hospital. So an emergency room, an ICU, and with the specialty of COVID is that it's so infectious that patients need to be separated from one another to keep the viral load down in the air. So rather than just putting out a bunch of cots, we need to have separate rooms for the patients. So that's a logistical challenge. Here in Austin, people will be familiar with this dashboard here. The city has set this up, and it's something we checked every day to sort of tell how soon we needed to have this alternate care site ready. I've been on the task force since April, and we didn't really move into our site at the convention center until June. And as you can see there, that's when cases really started to ramp up. So there was a lot of overtime work just getting this ready, as we thought we were about to activate any moment. So selecting a site, we looked at different locations. The Circuit of the Americas had a lot of positives to it. There's a lot of space there, parking and traffic would be no issue. There's also a helipad for medical evacuations, and it had a clinic on site. And we did site evaluations with assistance from the Army Corps of Engineers, who are pictured there, that just sort of evaluated everything from electricity, plumbing, evacuation routes, safety concerns. We ended up going with the convention center because it has 5 exhibit halls of at least 80,000 square feet that we were able to establish a footprint and then duplicate it if we needed to expand in the worst case scenario. So our first headquarters were in the isolation facility. It was a ballroom. It's kind of cramped quarters. You can see there on the left. That's what we were working out of as we were evaluating sites. And then once we moved into the convention center, we had a ballroom, and we were able to spread out and really dig into the work. And as plans chief, my first task was planning out the policies and procedures. So everything that could happen, we needed to have a plan for it. Laundry process, patient treatment processes. And the way that we did this was by looking at best practices across the nation for field hospitals, consulting subject matter experts, and going off of the policies and procedures of the isolation facility that were already in place and just building off of that. So the first problem I want to talk about is the layout of the exhibit hall and how are we going to maximize the space to fit in all of the tents that we needed to in order to have the maximum amount of capacity. So we started this with a simple hand drawing, looking at how the flow was going to go, where were we going to put the treatment tents, where were the evacuation points going to be. But the program that we used for this was a computer automated design called Vectorworks, which I wasn't familiar with. As a UX researcher, I'm familiar with Sketch and Figma, things like that. But the whole team had to familiarize themselves with this computer automated design software. So we were able to get a plan that the fire department and everyone could see and evaluate and approve and get on the same page as. Also, you can see our ambulance flow routes had to be mapped out so that we could get patients in and out safely as well. Some considerations for the layout were we had to have a shower trailer there because patients were expected to be there for weeks, possibly. And the treatment tents for decompensating patients there on the left, the 2 yellow tents, we wanted those to be as far away from the main patient population as possible. Because if a patient was crashing, their condition was deteriorating rapidly and we were doing CPR on them, we didn't want to spread that trauma around other patients because it's a pretty tight quarters in there. So trying to get that as far away removed as possible. In the middle, you can see that the first thing we had to do was lay out an electrical grid. That's what those boxes are coming out of the floor. And then we move the tents on top of them, and then we move the beds in next after that. So using that computer automated design software allowed us to make sure we had all of this in place and were able to maximize our space. The second design problem is distributing oxygen. And one of the unique things about a COVID-19 patient is they need a high flow amount of oxygen, 10 liters a minute or more. And distributing that amount of oxygen across an 80,000 square foot exhibit hall was a challenge because in the normal plastic tubing of oxygen delivery, the pressure decreases over the length of the tubing. So we gamed out a couple situations and scenarios of how we were going to accomplish that. And what we found is that building a truss rod system, like scaffolding, like you would see for lighting fixtures in a concert or something like that, and then having copper piping be the initial oxygen delivery method, was we were able to keep the pressure the same from one end to the other, and then have the last mile delivery of the oxygen be plastic tubing that came off of that. So on the left there, you see two oxygen generators. The tan one on the left is a military grade one that they would put in a war zone, something like that. And then the one on the right is a commercial grade oxygen generator. Between the two of those, we're able to create 500 liters a minute of oxygen. And then it's just doing the math of how many patients that will support. The third problem was, where are we going to get the staff and how are we going to train them? Because this is a completely unique scenario. This is different from a hospital. It's different from a shelter. And the staffing resources in the Austin area were already tapped out due to the surge that was happening in the hospitals at the time. So we had to recruit, we had to go to staffing agencies, and then we had to build a training program completely unique to our operation. And we had to make it so that we could train people to do this kind of work in 2 to 3 days because we were about to activate, we were prepared for that. So the way that we did this was had patient actors come in, many of them librarians. And a lot of the members on our team were librarians as well. And the reason for this is that during COVID-19 and the quarantine, all of the libraries in Austin closed. So a lot of the librarians who were working online had the capacity to help us out. So librarians were really clutch in this entire effort of the alternate care site. And they were patient actors for them. We would give them scenarios, try to elope, try to, have a psychological break. What happens if, a patient, is being unruly, things like that. So we trained for all of these, and ATXN, the City of Austin's local in-house television station, captured one of these training exercises. And I want to show a video of that to sort of give you a picture of what those exercises looked like.
You ready for some R&R? One of the biggest reasons for an alternate care site is to help alleviate that stress and that burden on hospitals. As we saw up in New York City, very on in the outbreak, their medical system became severely overwhelmed. So the idea is, if you build an alternate care site like this, the hospitals then can transfer patients out of their hospital systems to here and then leave space in the ICUs for the patients who really need it, those who are on ventilators and need 100% oxygen. Each patient would be provided with an iPad and a set of headphones. We also have 2 locations set up that will provide emergency care if needed. They would take the patients over there, they could perform triage and try and get the patient stabilized before they would transport back to a hospital. Can you tell me your name and date of birth? This whole process from the very beginning, we started in early July to where we are now. It's probably been about 2 months or so of around-the-clock work. The alternate care site and its setup has certainly been amazing to see what we've been able to do with as limited resources we've had. Everybody's been burdened by COVID, and so everybody's competing for the same resources. But the work that we've managed to do here at the alternate care site and potentially take up to 250 people in the initial phase and provide the resources and the level of medical care that we can here at this facility has been impressive. Fortunately, we haven't needed it. The hospital systems have been doing fairly well for the Austin region. And so this still is just kind of an insurance policy of it doesn't take very long for us to reach those critical levels again. And flu season is coming up. So we just never know what's around the corner. And so we want to stay prepared and vigilant and continuing to refine that process for any future hazards that may happen.
So one of the things I think that shows is that the value of prototyping and prototyping in the service design lab has been one of our most effective ways of seeing if something's going to work. With the Violet Bag and Cabinet Garbage Collection program, we started with 3 kiosks. And with the idea that if you provide people with garbage bags and a regular pickup route, that people will pick up garbage. That proved successful, and we just expanded that to now it's over 25 kiosks around the city of Austin, providing garbage collection services to people experiencing homelessness. And when we did these training exercises, it was a way to sort of, in a small footprint, test out ideas to see what's going to work and what isn't going to work, and what we need to prepare staff for. So the value of prototyping, I think, is clutch in this whole alternate care site program. So where we stand today, the alternate care site still exists. The tents are all set up. We're still watching the numbers in Austin. The hospital admissions are down. We're currently in stage 3. So we're in a phase of the alternate care site, which we call preserve in place. A lot of our staff have been demobilized and gone back to their original positions in the city of Austin as things start to open up and normalize. But we have a core team that's still there watching the numbers. And if we go to the next down phase, that would be called store to surge. So everything's going to get inventoried, tagged, and stored in City of Austin warehouses to where we'll be able to activate in a couple weeks if we get the order to. But fingers crossed that that doesn't happen. And the main takeaway from this is that everyone who was on this team learned their positions as this program was put together. These are civil servants, they're librarians, water technicians, designers, and these are the people who really came to help. And I think the message I take away is that when disaster strikes, there's not always going to be a cavalry coming for you. It's going to be plumbers and paramedics and librarians. And through the resiliency that I witnessed on this team, I'm inspired, and I know that we're all going to be okay because we have the capacity to meet the challenge. So that's it. Thank you so much for coming and letting me tell our story. I can take questions from anyone in the chat. Sure, I see, paste a link to the video in the chat, sure. What was important to consider in the design process and collaborating with such a diverse team at a high pace? I think everybody recognizing what was their best strength. So a lot of librarians became our logistics folks. They were very comfortable with inventorying things and following up on orders, things like that. As a designer, as a researcher, I gravitated to plans. And so in order to put together the team most quickly, we just had people go to where their expertise sort of led them. A lot of paramedics are in our safety division, and et cetera. So just realizing where people's skills were and mobilizing them to help in that capacity. All right, hold on a second. All right, so I posted that link in the chat. Let me know if you can't get it. All right, what was the biggest area of ambiguity when researching for this? Let's see. Just how many patients we were going to be able to fit, and how many we could care for safely. We planned for originally the 250 patients, and seeing how many times we could replicate that. The biggest question was staffing. Where are we going to get the staffing? I think I'm pretty confident in that our layout was replicable in all the different exhibit halls, but the question of where we were going to get the staffing and how can we train them quickly enough was the biggest question mark for me. And the biggest area of ambiguity when researching it is that there really is no playbook for doing this. This is something we all had to figure out. We did calls with people from the Javits Center, people from San Antonio and Houston, where they were building their own alternate care sites. And really it's something we put together just from consulting subject matter experts and looking at the best practices and what was working and what wasn't working in different cities. All right. Is there anything unique about your role as a user researcher designer when working for the city of Austin Service Design Lab? What's unique about it? I think that what I like about it is that we design for all residents. It's not sort of like we're solving problems for rich people or poor people. It's everybody, and it's really doing a resident centered, focused design is what's unique about it, I think, when compared to other types of design. How are the efforts in each city managed to be shared among other cities and efforts? Really not formally at all as of yet. We do calls and meetings with other cities and other alternate care sites, but I think that after we sort of get some space between us and what's happening right now, that there's going to be a formal sort of federal playbook for how these are put together. In some cities, the military runs it, and some cities it's a hospital-led thing. Austin's response was kind of unique because it was city employees who were leading the charge. But I think after this, there's going to be some knowledge sharing, and we're going to really have best practices of an alternate care site established. So elaborating on the 3 design problems. So the training exercise, I think in a design thinking capacity was, for me, the value of prototyping. Is the first one we did, a lot of things didn't work right, so we had to iterate and go back and change those things in order to make them successful. What tools do we use to design sites like these? So the technical tools we used were Vectorworks. It's a computer automated design software. As far as technical tools, that was the only design tools that we used. And how do you think this will affect future health or weather-related crisis events? Well, I think we have a level of preparedness now that we didn't have before. And even if we didn't use the alternate care site, I think that the lessons we took from this can be applied. If there's a nuclear fallout, if there's a massive hurricane, earthquake, at the same time as a pandemic, I think these are all lessons that we can build, and they're going to be cataloged, and they're going to be accessible to the next time that we need to stand up a structure of this kind. So budget, did we have to work with a budget constraint? There were budget constraints. That really wasn't my area, but everything we did was evaluated from a budget standpoint, and trying to keep costs at a minimum at all times. So there was a budget constraint, but I don't know the exact number. I know that when Houston stood up its alternate care site in one of their football stadiums there, it was in the tens of millions. But we didn't, our budget's nowhere near that. I think we did this pretty economically, but I don't have specific numbers on that.
Hey, Mark, it looks like there's also some questions in the chat if you want to check those out as well. If it's easier, you can stop sharing your screen and check out the chat as well.
Okay. Can you hear me live answering the questions on my audio?
Oh, yeah, going great.
Okay. Oh, the main chat. Okay, cool.
Yep. So one of the latest one here is, did you take any volunteers in your department, and how did you go about reaching out to volunteers?
So we were all City of Austin employees. There weren't anyone volunteering for us that didn't work for the city, and that's just kind of a procedural thing. We were working on a policy that would allow us to take volunteers from the community, but we never got to that point. If we needed to, we were prepared to do that, but so far the entire operation was done in-house with city employees and county employees. How many patients can the hospital fit? Our initial footprint was for 250 patients. We were ready to expand that to 2,000 using the other exhibit halls. But there's 250 beds and hospital rooms there. So the question of, are we going to take patients from other areas? I think absolutely would take patients from other areas if necessary. But initially this was planned as being for the Austin area residents. Did we coordinate with other cities around Texas or other states to ensure the same kind of standards were being incorporated throughout the design process? Yeah, so we did do a site visit to San Antonio, who had a similar operation. Theirs was unique in that it was set up by the fire department and totally staffed and run by the fire department, but they had tents set up inside their expo center. And they never activated, but they're ready to go. So we went down there to see what that looked like before we started building out ours. Also, there's an alternate care site that activated in McAllen on the border that we also visited to see what kind of considerations that they were doing. They actively had patients. So the Purple Bin program, this actually ties into the alternate care site because we have purple bins at the alternate care site. Those are coming from the Keep Safe Storage Center for people experiencing homelessness. Since the alternate care site was for all residents, we assumed and expected that we were going to get residents experiencing homelessness. So, as paramedics know, when you pick up someone experiencing homelessness, a lot of times they have 5 or 6 bags. So you have to take all of their possessions with them. So then that goes to the ER and then that goes to the hospital. So we had a storage program in place at the alternate care site, and we had around 30 violet bins there that we borrowed from the Keep Safe Storage Center. So it's kind of nice to see a pilot program from the Service Design Lab crossing paths with the alternate care site. And as far as what issues have you encountered from a security standpoint or any resistance from nearby residents? No. The Keep Safe Storage Facility, it's at 12th and Red River, and we haven't had any problems at all with security or nearby residents yet. It's been really successful. Did other organizations assist with the process and provide support? No. Like I said, everything was in-house. Red Cross actually did take hurricane evacuees in a different exhibit hall of the convention center right next to the alternate care site. a few months ago, but the paths didn't cross over. They weren't involved in the alternate care site. In your prototyping design, are there things like parking lots or places where trucks dock and load supplies in your, yes. Yeah, spatially, we had to look at all of that. You know, there's a shower trailer inside the exhibit hall for the patients, and there was one outside in the service yard for the staff, because the staff are going to be there, you know, for 12 hours at a time. We wanted to provide a place for them to shower, you know, after their shift, and doff and don their personal protective equipment, things like that. So yeah, the entire layout had to be looked at spatially. Design question: do you get to share, borrow designs from other countries who have come up with their own COVID sites? Yeah, actually, the copper piping was an idea from Spain. They had set up a alternate care site in, I believe it was a bullfighting ring originally, to deal with their surge. And they did copper piping for oxygen, and as a way to maintain pressure from one side to the other, and they did it under the ground. So we weren't able to, you know, get under the ground of the exhibit hall, but we took the copper piping idea and put it on the truss rod system. What were some of the strategies you explored with the layout that didn't end up working? How many iterations of the layout did we go through? Wow, like probably 10. So we originally were going to get a tent system. We were looking at a tent system that was going to be sort of prefabricated and come in rows and built out with a pipe and drape system. But we realized that as we went through the iterations of the design, that wasn't going to provide us with enough ability to move around the tents, you know, one by one. So we ended up just buying separate tents to sort of play with the design as we were, you know, looking at where we're going to put the ICU tent, the shower trailer, things like that. So having the tents be single units kind of really came in clutch when we were moving around the design.
Great. It looks like you've answered all the questions in the chat. If anyone has any more, feel free to post, or we'll go ahead and wrap up. These are awesome questions. Thanks everyone for participating.
How long did it take? A few weeks. Yeah, you know, through the research to, you know, sourcing them and then ordering them and getting in. A couple weeks, really. This all kind of occurred in June and the first part of July as far as the layout. Things that didn't work. So many things. One thing that comes to mind is we were initially going to have oxygen by tanks to try to avoid us getting those massive generators. But we just learned quickly that having that many tanks with the amount of high flow oxygen that needs to be distributed, you would have to change the tanks so many times daily that wasn't going to work. So we sort of shifted gears and went for the oxygen generator route. And how do I think this will affect future health or weather-related crisis events? I think that we're going to be more prepared than we ever were before. So it's kind of weird to work on a design problem for 6 months that didn't get used. When we put all this work and hours into it, but we don't want it to be used, right? That would be the worst case scenario. So what is the lessons, coming out of this is that we were knowledge building, all of these, this is going to be cataloged. It's going to be talked about and compared with other cities so that we're going to be able to stand up an alternate care site now. So if, the worst case scenario happens, we're going to be way more prepared now than we ever were before.
Awesome. Well, it looks like that might be, I guess, one last question.
Yeah, we did have a staff break room set up with lockers for the things. Yes, with cots to take naps as well.
Okay, great. Well, thank you so much, everyone. Mark, do you have any final words? Thank you so much for this awesome talk. It was wonderful.
Just thanks for your time and thanks for listening. And I really just want to tell the story of a really extraordinary thing that happened that I got to be a part of. And, I'm just inspired, with how people rose to the occasion of this design challenge.
That's wonderful. Great. Well, thank you so much to Mark, and thanks everyone for joining. There is a survey posted in the chat, so please go ahead and click on that and give your feedback. And that's it for this event. Please check out the rest of the schedule for the rest of the week. All right. Thanks all.
Everyone.
Awesome.